Welcome to today's show. I'm your host, Dr. John Bartemus, and as always, before implementing anything we discuss on today's call, please speak with your primary care physician. Today, I'm excited to discuss anxiety and magnesium. And many times in my practice, patients are dealing with anxiety and or depression, some sort of what's considered a psychiatric issue. And oftentimes, all they've been offered is some form of antidepressant medication or something like Xanax. And if you have an issue driving the anxiety that is outside, say, a serotonin issue or a benzodiazepine issue, then those medications aren't going to be helpful. So today we want to look at two mechanisms that can be driving anxiety and other neuroinflammatory issues like migraine, depression, pain, but we'll focus on anxiety today. We want to look at two mechanisms that could be driving that, which magnesium could be a key player in. And magnesium, if magnesium is lacking, if you're insufficient in magnesium or deficient in magnesium, then these things could be exacerbated, leading to anxiety. And statistics show that up to 78% of Americans are deficient in magnesium. So this is likely a player in many people's cases that report anxiety. So let's dive in. Today you get to see my artwork because I'm going to draw it for you. So the first mechanism has to do with our neurotransmitters, and we have an excitatory neurotransmitter called glutamate, and glutamate is our main excitatory neurotransmitter. So think of glutamate as the gas pedal of our brain. If you're receiving glutamate, you're going, okay? It's excitatory, things are being turned on. And we have an opposing neurotransmitter called GABA, and GABA is the main brake pedal neurotransmitter. So glutamate, the gas pedal, is converted to GABA, the brake pedal in our brain. And in order for that to happen, we need an enzyme called GAD65. And GAD65 is the enzyme that converts glutamate to GABA, that converts glutamate, which could be pro-anxiety, to GABA, which is anti-anxiety. Okay? And so GAD65 is an enzyme that makes this conversion happen. Well, enzymes require nutrients to work. They require nutrient cofactors. And without that required nutrient cofactor, that enzyme will not work at all or will not work efficiently, depending on are you insufficient, deficient, etc. So what nutrients does GAD require? GAD65 requires 3 nutrients. One of them is iron, one of them is vitamin B6, and one of them is magnesium. It had to be magnesium, right? Because we're talking about anxiety and magnesium. So magnesium, iron, B6. If we are insufficient in any of these, then we may have a train wreck or a bottleneck here at this GAD65 enzyme, which would result in a buildup of glutamate. Whoops, that was ugly. Sorry about that. Which would result in a buildup of glutamate and a decrease in GABA, which provides a net pro-anxiety environment, right? So we want to make sure we have enough magnesium, we have enough B6, we have enough iron. Why wouldn't we have these things? Well, we could have poor dietary intake of them. We could have poor absorption of them in the GI tract. As regards iron, if you're a female with a heavy menstrual cycle, you may be losing more iron than you're taking in, leading to an iron insufficiency or deficiency over time. And then you have poor GAD65 function, not enough GABA, increased anxiety. So magnesium, iron, B6, important for that conversion. Now the next thing we want to talk about is the second mechanism, and glutamate is important in this second mechanism here. And the second mechanism is called excitotoxicity. So if we have a cell, this cell is a neuron. And in our neurons are in our brain, are in our spinal cord, and are in our peripheral nerves. So we need optimal functioning of our neurons for things to work, for thoughts, for movement, for all of our bodily functions. And a properly functioning neuron leads to proper bodily functions. An inflamed neuron may lead to neuroinflammatory symptoms such as anxiety, depression, pain, migraine, etc. Well, glutamate is an excitatory neurotransmitter, and glutamate binds a receptor on our neurons called the NMDA receptor. And so if glutamate is binding that NMDA receptor, what happens is that it binds the receptor, and glutamate results in an increase in intracellular calcium. So when calcium goes up in the cell, you have the result. Excuse me. The result is that your nucleus, where your DNA is, produces more protein. And the proteins, like we talked about GAD65 enzyme above, the proteins do work, and so whatever that cell does more of. So you have a protein production in the form of an enzyme, and when that protein does its work, the work of the cell is done. So in the case of a neuron, you have an action potential, and a thought occurs, or a movement occurs, or some sort of function occurs. So out here, you could just say everything, whatever that is specific to the cell occurs. Now, if you have too much glutamate, that can become what's called excitotoxic. And excitotoxicity leads to an increase in intracellular calcium, which leads to an increase in inflammation. And if you have an inflamed brain or an inflamed neuron, then the resulting symptoms can be many. And one is anxiety, one is depression, one could be pain, one could be migraine, okay? And that's in the central nervous system, so brain and spinal cord. This also occurs in the peripheral nervous system. So if you have an inflammation in the peripheral nerves, that could be peripheral neuropathy. It also occurs in the muscles. Excitotoxicity can occur in the muscles. So you could have muscular trigger points. If it's affecting your smooth muscle, you could have hypertension. So this is a big deal. Too much glutamate or homocysteine also activates the NMDA receptor. So too much glutamate or too much homocysteine leads to too much intracellular calcium and inflammation of neurons and resulting symptoms. So we don't want that. Well, how can we naturally decrease or prevent this excitotoxicity? Well, we're talking about anxiety and magnesium. So again, magnesium comes into play here. And if we take magnesium and put it right here, okay, magnesium can bind this NMDA receptor. And a specific form of magnesium allosterically fits this receptor quite well, and that's called magnesium glycinate. So in excitotoxic cases, magnesium glycinate binds this NMDA receptor, preventing glutamate or homocysteine from binding, and that way you don't have the high intracellular calcium and the excitotoxic effects of the cell. So there's the potential that magnesium glycinate could be the answer to an individual's anxiety, could be the answer to an individual's depression or migraines or pain. So I hope this helps some people out there. I hope it's a simple, inexpensive, and effective way for some people to deal with their anxiety, maybe eliminate it totally or at minimum reduce it significantly. And if it is, please let us know in the comments. Please let us know on social media, because we like to celebrate simple solutions. So again, as a recap, anxiety is ubiquitous in our culture, as is magnesium deficiency. As the research shows, up to 78% of people are deficient in magnesium. Magnesium plays a big role in conversion of the gas pedal glutamate to the brake pedal GABA, big role in the conversion of pro-anxiety glutamate to anti-anxiety GABA. So if we're lacking magnesium, we may build up glutamate and drive our anxiety higher. If we're building up our stores of glutamate, that may increase glutamate binding to NMDA receptors, which increases intracellular calcium, is excitotoxic, and drives inflammation in the brain, which can drive anxiety, depression, pain, migraine. So if we can take magnesium glycinate and plug that NMDA receptor, we can stop that increased intracellular calcium and dampen or eliminate the anxiety, depression, pain, and migraine in some cases. So again, hope this is helpful. Speak with your general practitioner before implementing these things, and let us know in the show notes if you're excited about this and if it was life-changing for you.